which we can see in university students. But these domains of diversity generally is perceived that these are negative characteristics, because due to these diverse characteristics, we deal the people who are in minority in a discriminated way. These students are not provided the full resources, or this may be the perception of these students, that they are not getting the full resources and they are the disadvantaged people. So basically, we need to change this perception, and we need to utilize all these domains which are considered as minority or discriminated or disadvantaged characteristics in a positive way. Because when we will utilize diverse characteristics for some positive thing, it will generate tolerance among people, it will generate the perspective taking among youth, and they will actually tolerate others' point of view. There will be less conflict, and they will learn to deal the problems in a positive way, and they will also get alternatives to get engaged in positive activities. So, can higher education and cultural diversity are linked for drug abuse or drug reduction? This is a big question, and I think we can work on it, and it can be that this diversity can be positively used by distributing the resources to all students in equal way, by changing the mindset, beliefs, attitudes, and values of university's culture. And the important thing is by controlling the supply of substance use. The supply of drugs in university, I think, should be totally banned, so that it cannot part of the university culture. So this can be a big step if then we can, I think, successfully work on any program. Some basic strategies for drug abuse prevention which are generally being used in these days are like information disseminations, in which advocacy programs, seminars, awareness and risk factors and protective factors about the drugs are shared with the community, and people make aware that how they can avoid these drugs, what are the negative effects. So generally, this kind of prevention programs are not very successful, because we can see that there are a number of advocacy activities being done, but these may not be very successful, at least when they are drug abuser or when they start taking drugs. Then there are prevention education programs in which the positive factors are focused and enhanced among the abusers and among the social support system. Then there are alternative activities which we may provide students to get engaged in positive things, positive activities. Then generally we target the population who are drug abusers, and then we refer them for treatment. As we have seen that number of people are working on treatment and interventions. Recently, we have also started community-based processes in which we do engage community leaders, or sometimes we make some societies in which we also use the peer mentoring system, and sometime in religious places we start some kind of work to reduce the drug abuse. Then environmental approaches which work on the culture or climate in which the drug-free culture is being promoted. So all these efforts are already being done, or we are working on this. Actually, for diverse culture, we need the culturally responsive services. Recent researches have shown that to provide culturally responsive services, one must work from a culturally humble stance. And for this, cultural humility is a technique that is used in which the provider's willingness and openness to demonstrate respect and lack of superiority when interacting with those whose cultural identities, values, and worldviews differ from their own. So these 2 points are very important, that you give respect to other cultures and you show lack of superiority, that all the culture are equal, no one is superior or inferior. So considering these 2 points, the broaching technique is a skill or strategy that demonstrates and enhance cultural humility. In this, basically, we take the cultural responsive care in action, and we work to respect other culture, and we can see the cultural humility in action through this technique. And this strategy is